Assalamualaikum warahmatullahi wabarakatuh. My name is Aisyah Fadhilah binti Khair-ul-Nahar. My matrix number is 23DBT19F1062. So today we'd like to present about genetic testing patient with suspected familial hypercholesterolaemia.
I'm Srtharan. I want to summarize the issues. The article is about the genetic conditions that result in elevated low-density lipoproteins, cholesterol, LDL-C level with consequent increased risk for premature cardiovascular disease, which called familial hypercholesterolemia, which consider an autosomal dominant genetic conditions. So the patient was who was not formally diagnosed with FH, but the mutation genes was detected through this genetic testing. These mutations in an ApoB gene via testing by Amiliya genetic that included next generation sequencing technologies of ApoB, LDLR, and PCSK9 and LDLRAP, which is mutation genes that cause this disease. This genetic testing confirmed the diagnosis of FH. Later, she recommended with some treatments, several treatments such as statin medications, which does not tolerate her much, and she started on Overlocum 140, and she also was educated with what diagnosis of FH really is about. In this article, there is several impact of genetic testing and the treatment that she undergoes was mentioned. Besides impacts, this article also state that the stakeholders regarding this need to develop more efficient ways of selecting patients for genetic testing in response to elevated LDL level. This article is mainly about the genetic conditions which called familial hypercholesterolemia was solved or detected by genetic testing using NGS technology and Amiliya genetic testing.
So what is genetic technology? Genetic technology is the term given to a range of activities concerned with understanding gene expression. It also taking advantage of natural genetic variations in understanding modifying genes and transferring genes to a new host. Genetic technology is used to transfer a beneficial genes from related species into crop plant in a direct or efficient way. Genetic technology is one of aspect of biotechnology. It involves introduction of new and altered genes in the laboratory. So, in this issue of familial hypercholesterolemia, the genetic technology that was used is next generation sequencing. Basically, the patient was found to have pathological variant, which is a mutation in an ApoBeta gene via testing by Ambry Genetics that included next generation sequencing. NGS-based testing for a population-based approach to familial hypercholesterolemia detection may not be cost-effective, costly with longer time to process and analyze results, but it is comprehensive detections of known and unknown mutation. While if they use PCR method, there will be greater sensitivity of targeted set of known mutations.
Assalamualaikum to Madam Jannah. My name is Rasyidah Amiliya, binti Rosdi, and my matric number is 23DBT19F1020. So today I'm going to present about the positive impacts of the genetic technologies in our issues. So that the first one is that towards the individual, which is that as we know that NGS can be valuable results in the diagnosis of FH, and it also can help to recognize the specific mutation that is responsible for the condition in an individual. And the second one is that towards the society, which is that it can add to the knowledge regarding the prevalence of the various types of the FH related to the mutation among the community. And it also the patient will be educated towards the what is the diagnosis of FH meant for their health, and the importance of the first degree relative evaluated of the FH. And the third one is that towards the law, which is that before the patient can proceed to have their diagnosis of FH, they need to fulfill the phenotypic criteria or the clinical criteria, which is it will be more easy for the clinical to make an observation towards the patient current status. And the fourth one is that towards the country, which is having the, for example, that having the advanced technologies such as next generation sequencing, there will be less of patients that will have the diagnosis of FH, and also there will be low rate in the early death in the certain countries. Next is that negative impacts of the genetic technologies. Okay, so the first one is that towards the individual, as we know that these genetic tests for the FH are very expensive, but effective. And the second one is that towards the society, which is for example, when it comes to a very high demand of these genetic tests for FH, these genetic tests of FH will has to come to its limitation. And the third one is that towards the law, which is by using these genetic tests, genetic tag, this there will be need for the genetic counseling to be offered to the patients to have the patient consent. The fourth one is that the negative impacts toward the countries is that there will be more and increases in the supply cost, in the machinery fees and the training expenses for the NGS. And as for the list strategies on how to tackle the negative impact, is that the first one is that using of the cascade screening. It can be more cost efficient strategy for diagnosing FH. And the second one is that carefully selecting patients to maximize the utility of genetic testing in FH. So that's all for me. Thank you.
And then is strategy on how to tackle the negative impact. The third one is maintaining consistent and accurate test result, which can keeping your lab output as high as possible, which reduce the cost of supply and machinery spent. Then next is reducing the need for retest. This can happen when the patient was educated with genetic or undergo the genetic counseling for making the problem of patients more clearly and can reduce the retest.
Finally, all things considered in this genetic testing, hypercholesterolemia, they help to establish a definitive diagnosis and enhance family member screening using genetic technology of NGS, which is next generation sequencing. As can be seen, genetic tests for FH or familial hypercholesterolemia are expensive and can raise ethical issues, but it has a comprehensive detection of both known and unknown mutations. Generally, there is a need for developing appropriate guidelines for clinicals in conducting genetic testing. That's all from us. Thank you.